Hello, my dear friends. Today we are going to talk about ulcerative colitis. I see a lot of patients from around the world, from India, from everywhere, all the continents, and many patients they complain that they are not able to get me. They are not able to understand how to book online, how to connect with us. So it is not very difficult. You can just go to our website, planetayurveda.com, and you can see that there are links where you can do online booking. So today's topic is about how ulcerative colitis can be managed, how we can reverse. Is it possible in Ayurveda to get rid of the disease, or is it possible to solve the problem? Ulcerative colitis is a scary problem. People get scared, and moreover, whenever they go to doctors, they tell them everything what is written in their books. Usually, they tell them you will get cancer, your colon will have to be removed, and so many such disastrous statements they get, and this leaves a big impact on their mind. So this is a common question, that is it permanently curable? I will be talking about this, whether it is curable or not, in the video. And the important thing is whether you can live a happy life or whether you can live a peaceful life while with this disease. This disease goes into remission. This goes into peaceful state. You can live happily. You can live calmly. I see now people joining. Previously, I was not seeing anybody, but now a lot of people are there. So the topic is whether what to do, what is the lifestyle, what is the diet which patients should eat, and how they should live. So it is ulcerative colitis. You have to follow a regular, first of all, regular lifestyle routine. If you are not following a routine, then there is a problem. If you are not sleeping in time, if you are not getting up in time, if you are traveling too much, that is also a problem. The travel leads to a lot of issues. Travel can aggravate vata. So first of all, we understand what is ulcerative colitis. Ulcerative colitis is a disease which is autoimmune disorder. Autoimmune means our own immunity is attacking us, and then the inflammation is there in the colon, and colon is the seat of vata according to Ayurveda. And when the vata gets aggravated, then all the problem starts. So very quickly, I'm going to tell you what to do every morning whenever you get up. First of all, don't consume any teas which you are consuming, especially the milk tea. So just consume this cumin, fennel, and coriander tea, or cumin, fennel, and thyme tea. You know, thyme and cumin and fennel, these are all easily available in the kitchen. These are kitchen remedies. And just take a tea in the morning and in the evening whenever you feel gas and bloating. Many patients they complain. I think people want to hear the answers. They don't want to listen to the lectures. They just want to hear, is this? So I will straight away come to the questions and answers. There are a lot of people, so I don't want them to miss the questions and answers. Is it permanently curable? This is a very big question. Well, according to books of modern medicine, this is not permanently curable. This is what modern medical system says. But Ayurveda doesn't say it is ulcerative colitis. Ayurveda says it is Raktatisar or a Pittatisar. So according to Ayurveda, Raktatisar and Pittatisar, they are both curable. They can be cured with living in a natural lifestyle, following a lifestyle which is in coherence with natural principles and laws of Ayurveda. So according to Ayurveda, it is curable, but according to modern medical system, it is not curable. So I cannot say that it is curable on live TV, but actually I can say that Raktatisar or Pittatisar is curable. So many patients I have seen in my 25 years of medical career, So they are fine. So you call them cured or you call them in not cured. It is up to you. But they are still sitting in this chat room. There, a lot of testimonials are there. A lot of data is there. We have. So I can assure you that Ayurveda can give you very happy and and healthy life. How many months I should take the medicines? Well, it depends. Many of my patients they are feeling better within few days, within 1 month, within 2 months. But some patients they take 2 years, 1 year, 2 years. But most of the patients they get fine within 6 months. So they get much better response within 6 months. They feel better within 1 month. So you can start with the Ayurvedic medicines. And the next question is if ulcerative colitis is leading to mucus and blood. These are the symptoms of ulcerative colitis. Lot of blood, lot of mucus is there. So simple home remedies, I would suggest you should drink some coriander leaves juice every day. Every morning, just take one small glass, about 50 ml to 100 ml of coriander leaf juice, and just consume it as it is. Or there is a grass, very common grass, durva grass, which is growing in India everywhere. So you can consume durva grass juice or marigold flowers. You can just make tea of the marigold flowers, the petals, just beautiful marigold flowers. You can make the tea. Hibiscus tea can you can also take. It is also cooling. Rose tea also you just take some rose petals. Just avoid the normal tea which you take. Most of the people they take the black tea or black coffee. So black coffee and black tea is altogether prohibited. It is not allowed. Don't take black tea, especially milk. Milk is not at all recommended. Many patients they end up with flares after consuming milk. So I don't recommend milk. And also cheese in any form I don't recommend, because cheese can lead to flares, and it is most of the patients they are also lactose intolerant, and that can also cause. It is not only about lactose but also about the constitution or the nature of the cheese. In Ayurveda we see the nature of all the food elements or food items. So according to your prakriti, you must consume the food. Every person is different, so most of the diets sometimes they can vary according to the constitution, according to the prakriti or the constitution of the person, of the patient. At our website, you can go to our website and check your constitution. You can do the analysis and you can find out what is your constitution, what type of diet will be suitable, especially for you. So what I have observed, ghee is perfect because in ulcerative colitis, the justifier is upset, the ama is forming, and there is a imbalance of pitta. So ghee is something which is balancing vata as well as pitta. So the seat of vata is colon, and colon is inflamed, and that is pitta is also in imbalance. So we need to control the vata. We need to balance the pitta also. So ghee is something which is very good for vata as well as pitta. Avoid all food which is dry in nature, like dry chips, these cornflakes, these chips, or all the food which are also fried in nature. So avoid all the burgers or the pizzas and all junk food and fast food. So what you can eat, oats are okay, but they can also be drying. But if you take them with the water, soaked oats, they are okay. But not every day. But because many foreigners, people from USA and UK, they are also watching this live streaming. So the main diet is they eat cereals every day with milk. So I won't recommend that. That causes a lot of dryness in their gut, also inflammation and vata imbalance according to Ayurveda. So I would ask them to switch over to oats, and not with milk, but also with, but they can take with almond milk or soy milk or any other milk which is not animal based but plant based. So how many months? So people are talking with each other. Somebody is asking how many months you are taking. Somebody saying I'm taking for 2 months. Pitta balance. Pitta balance is something I give to my patient because pitta is always disturbed in this disease. How to make moong dal khichdi in Crohn's disease flare up? How to make khichdi? That is not very difficult. You can also look at the YouTube, but the main ingredients are rice and moong dal. These are the two ingredients because they are very light and also very replenishing. And you must also add some ghee in it. Always take uh, very soupy form of khichdi and also put ghee in it. Always don't make it very heavy and don't consume it frequently. At least give a gap of 3 4 hours. Breakfast, you can do breakfast with khichdi, and you can also eat it in the dinner, but do the dinner early, not late night dinners. And also don't skip breakfast, don't skip meals. Bananas you can take, yogurt you can take, also pomegranate juice you can take. Pomegranate juice is very good in this disease because it is astringent. It helps to stop the blood and also heal the ulcers. Pomegranate peels out, the outer cover of pomegranate. You can just boil it and cook it, and then make a herbal tea from pomegranate. And also potatoes, without any peel, outer cover. You can peel it off, or you can boil the potatoes. You can consume them. Also beetroots, sugar beet. Sugar beet is very good because it is full of antioxidants, vitamin A, as well as energy, and full of strength. So you can take this sugar beets. And the next question is it possible for me to do job of army or police? Yes, it is very much possible. I have a lot of patients who are in the army, who are in the police, and they are doing fine, and they are living their normal lives. Many of them, they are working. What about the vetiver root? Is it cooling or heating? Vetiver root is very good. You can soak the vetiver. You can make herbal tea from vetiver. Vetiver is cooling. So you can take, don't make sherbet or sorbet or the sugary drinks from the vetiver. In the market, a lot of sugary drinks from vetiver are available, so don't consume them. Only consume this vetiver roots uh, as a tea. And many patients, they say we are very upset, very sad, very anxious, very stressful. In fact, this fear also leads to imbalance of vata. In Ayurveda, fear is the root cause of vata. So fear is the cause of so many diseases, and it is directly connected with the gut also. So whenever you are fearful, obviously you will go to pass the stool. So don't be scared. I am seeing ulcerative colitis patients from last 25 years. That's why I decided that I should be uh, with you, trying to speak with all of you. So many patients are there, and so many of them, they are fine, and they come to see me, and they have given so many testimonials. And some people, they are asking about liver cirrhosis with KPA value of 35. So this is about ulcerative colitis, not liver cirrhosis. But yes, we will soon do a live session on liver cirrhosis also. I have many testimonials where patients with 75 kPa also, they have come down to 35, they have come down to 7. So it is possible to bring down the KPA levels. So you keep looking at those videos and keep following us. We have supportive team of dedicated doctors. You can just go to our website and book a consultation. Why you hesitate to book a consultation? I am not sure. Just go to the website and book a consultation, because even if you don't want to take the medicines, at least a doctor will be there with you for 15 20 minutes, and you can talk to the doctor. You can discuss about your disease. You can ask about the food or the lifestyle. So uh, nowadays, lifestyle has also become very dangerous. people are going to the club and discos late night. Basically, we should be sleeping. Our body is not meant to go out at night. We are just like other animals who are sleeping in the forest. Our eyes respond like that. Our brain responds like that to light. Whenever the light goes out, whenever the sun goes down, the melatonin starts to form in our brain, and there are special sensors behind our eyes which send the signal to the brain to release the melatonin. And but what we do, we just follow not we just not follow the instructions of nature. We just go out and start dancing even after eating. So avoid that. Also avoid raw salads. Don't consume cucumbers and all these salads and radish and carrots, raw carrots, or raw salad, or lettuce, or kale, or all colza. All these green leafy vegetables, raw salads, they are not good for ulcerative colitis. You fiber is good in general, but not for ulcerative colitis because it can lead to flare. So raw salads are not recommended in this case. Only warm cooked food is recommended. Just one principle you understand: you have to consume cooked food, not raw food. Try to cook and make it, consume it as soon as it is cooked, warm and oily and moist. Put some oily. By oily I mean put some ghee in it, not the refined or other oils. Sir, I get flare up in the rainy seasons. I have taken medicines, but still I get flares. So these medicines you are taking from so many years. You see, you are taking mesalazine and these steroids. It is okay to take for some time whenever you get high flares or flares in between. But slowly, slowly, under the guidance of a doctor or our doctors, you can be in touch with our doctors. Slowly, slowly, we will reduce the dosage. We will shift you from these steroids to Ayurvedic herbs like Kutaj Ganvati, like Pitta Balance, like Vatsakadi powder, like Belgiri. Bel, it's a fruit. So this fruit is having very good healing properties in the gut. So we will shift you from those pills of mesalazine and corticosteroids to these simpler herbs and the medicines. And slowly, once your gut starts to heal and the inflammation is down, slowly you will be fine. We will reduce the dosage and we will remove all the medicines. Even Ayurvedic also we will stop. Yesterday also there was a patient. He was saying, I asked him, "Do you feel any difference with my medicine?" He was very happy and smiling. He said, "Yes, sir. I stopped all the allopathic medicines and now I'm only taking only few of your medicines, only Kutaj Ganpati and Pitta Balance, only two of them." And he's feeling very calm and and happy. Some patients they say my ulcerative colitis is not getting in remission and it is not getting cured and I'm not getting relief. And what do I do? Even after taking Ayurvedic medicine. So you have to be in touch with our doctors. You should be in touch with our doctors. If you are not getting relieved, always get an appointment every month and try to find out what is the cause. Maybe you are sleeping late at night, maybe you are consuming coffee or tea, maybe you are not so relaxed mentally, maybe you are having stress, work stress, or some other family stress is there. So you must always discuss in detail everything, and definitely we will be able to find out what is the cause. Always consume cumin and fennel and thyme tea made from these three simple herbs which are there in your kitchen: cumin, fennel, thyme, or cumin, fennel, and we also have a tea called GR gas leaf kada. So this GR gas leaf kada is always can be consumed 2 to 3 times a day. It is good for the gas and bloating. Whenever you are done with your lunch or your breakfast, you can consume this kada, this tea made from these herbs. Many patients they say I am taking up that this is not getting cured. As I told you, you have to be in touch with our doctors every month or 2 months. But online is not very difficult. Just get an appointment with my team of doctors, and we will find out what is going on. If you have to take antibiotics for dental treatment, how to take precautions for flare-ups to never come again. You see, there are Ayurvedic herbs which work really well for the infections also. I am using certain Ayurvedic medicines instead of antibiotics. For example, I use tulsi, I use curcumin. This curcuma longa is very strong for all kind of infections. So I have seen even for flu also, or even for cough also, upper respiratory infection with fever. So we have Ayurvedic herbs. You can use them, you can try them, and if you are not able to get the herbs quickly, then you have the infection. You can discuss with your doctor, local doctor, which antibiotics can be suitable for your problem, along with the ulcerative colitis. And many patients they say, sir, it was good, but suddenly I got a flare up. What is the reason? Suddenly you get a flare up because suddenly you get into some kind of stress. Maybe some stress, some bad news. Maybe you are watching some news in the TV late at night, and all of a sudden you get fearful or scared, or maybe something happened in the family. So that sad news can lead to such problems. And also something you must have eaten, like something outside, something in the street food. Some people they eat street food, they like street food. Many people they follow my advice, but still some people out of their they're not able to control their urges, they go and they eat. So this can also be the cause, and that leads to such flares. Mainly the fear is the cause. So don't be fearful, don't be scared. Whenever you get scared, you book an appointment with our experts, you tell them the problem, and definitely just by talking also sometimes the talking and the communication gives peace of mind. So your problem can be sometimes solved just by talking. So always take online appointments. White jowar roti. Can we take jowar? Jowar is it is okay. You can take jowar, but it is increasing pitta. So always take in moderation, not too much. So jowar is fine, but it is having more fiber than the wheat. So and also in aggravating pitta. So if it suits you, so this sorghum or jowar can be consumed. These ancient grains they are very useful sometimes. These kutki or kodo millets they are fine, but very high in fiber. Especially this kuttu or the buckwheat. So buckwheat you can consume, but be careful about it. Somebody is writing after taking your medicine for 1 month. I have some relief. Thank you. Please suggest something for bowel movement, pressure control. Yes. So this pressure control, this urge, whenever you are eating food, you are not able to control the urge. You have to go to the toilet. So this is the Kutaj Ghanvati is something which helps. And also don't consume cold water and don't consume too much water. Whenever you are eating food, just imagine it is like a pan, and in the pan you don't put too much of fluid. It is just put the food in small quantity and put very little water or very little fluid, preferably warm water or warm tea also. As I told you, cumin fennel. This fennel is and fennel cumin and this coriander or fennel cumin or thyme tea. It is very good for gas and bloating. So even if you take it along with the food or after the food, very small quantity like 1 cup, that is good. In fact, I was also consuming some herbal tea, so I wanted to show it to all the audience. So this is cumin, fennel, and thyme tea. It is evening time. It is vata time. So vata time, this between six. This evening time is kapha time, but to keep me warm, I'm consuming this cumin, fennel, and thyme tea to avoid gas and bloating. So, we must remember the timing also, during the day, during the evening, during the night. What is the time of which dosha? As I told you, vata, pitta, and kapha. These are the doshas. Evening time is not vata time; it is kapha time. Between 6 p.m. to 10 p.m. is the time to sleep. So it is the time when we should go and prepare for sleeping. Uh, yeah. Pitta time is when the night starts, 10 p.m. to 2 a.m. In the middle of the night, 10 p.m. to 2 a.m. is Pitta time. So that's why that is a time of inflammation also. If you are eating at that time, if you are not sleeping at that time, between 10 p.m. to 2 a.m., that can aggravate Pitta a lot. So that you must take care. You must sleep between 6 p.m. to 10 p.m. So this is the time, kapha time. So and vata time is after the 2 a.m. So you start to wake up slowly, early in the morning, 4 or you get up. That is the vata time, and then 6 a.m. to 10 a.m. is kapha time again, and then 10 a.m. to 2 p.m. is pitta time. That is the time you do breakfast in the morning. And there is, I'm very thankful after your medicine. I am fine within 1 month. Little bit gas is there, and I want to gain weight. Yes, this is a very common problem I face. Patients, they say now I am fine within 1 month or 2 months, perfectly okay. They were going to stools 5 times, 10 times, 15 times, and were passing blood and mucus also. But after Kutaj Ganvati and Pitta balance and Arjuna, and all these Ayurvedic medicines, they become fine. In the flares, they are in control, and the disease go into remission. But sometimes they complain of gas. So gas and bloating, as I told you, just avoid the normal tea. Don't consume tea. Don't also be in a routine. Always be in a routine. Don't break the routine. Don't skip breakfast. Don't skip meals. Always take the meals in time. Always eat meal with ghee. Ghee is must. If you want to gain weight also, then ghee is must. You can also consume jaggery with ghee with rice. Rice is very calming and also very easy to digest. So you can take rice and this Indian jaggery powder along with ghee. So you will like it also. You will get a lot of energy. It is full of energy, and it helps. There is one person who sir face problems and saying no relief, follow sir's advice. Check your diet and take medicines properly. Yes, that is true. And one patient is writing, after taking your medicines, colitis is perfectly fine, but now I have the constipation. The constipation happens because the disease is of loose motions or diarrhea, bloody diarrhea and mucus. And bloody diarrhea and mucus is now in control with Kutaj Ganvati and Pitta balance. But now there is constipation. So you need to reduce the dosage, stop Ayurvedic medicine or reduce Ayurvedic. That's why I'm saying always consult with our doctors. The doctor will reduce the medicine, the doctor will stop the medicines. So all the patients who are taking our medicine, if they were complaining about diarrhea and bloody stools and mucus, slowly after 1 month or 2 months, they their episodes of diarrhea stop, and then they complain that now we are not going even one time. So they can reduce the dosage. They can stop the Ayurvedic medicine, but also at least discuss with our doctors. Then you will be able to understand how our medicines work. And also don't stop these allopathic medicines immediately. These allopathic medicines, you have to stop them or slowly in guidance of our doctors, or the doctor which you are following up with. Don't stop any injections or any steroids or any mesalazine or mesacol or Asacol or Pentasa. Don't stop immediately, just slowly, slowly. Sir, I'm getting nausea during ulcerative colitis. Few days ago, checked and doctor suggested it is mild gastritis. Please suggest how to control it. Yes, gastritis is inflammation of the gastrum. Gastrum is stomach, the upper part of the our gastrointestinal system. Our gut or the gastrointestinal system starts from mouth till anus. It is about 32 feet in length. It is a pipe. It gets little bit bigger at the stomach is bigger inside, but otherwise it's a long pipe. So when stomach is inflamed, that is called gastritis or the upper part. So if you are consuming any painkillers, if you are consuming some food and the previous food is not digested and you consume something else and you consume tea or some hot and pungent or spicy foods, that can lead to gastritis. So for gastritis you need to give rest to your stomach. You can consume some alkaline water like coconut water. Coconut is mm, sent by God, packaged by God. It is very uh, highly alkaline, so it can neutralize the acid in your stomach. So whenever you feel acid, always take coconut water. And in colitis also, coconut water is very good. So you should consume every day this coconut water if you can get. Or if you are in not in India or out of India, commonly people in USA they consume pumpkin. Pumpkin is very good for colitis patients. Pumpkin soups I would recommend in the evening. So pumpkin soup is good. You can consume pumpkin soup. Always put ghee in that. And the next question is how much time to follow diet after no symptoms and your medicines? When you have taken my medicine and there are no symptoms, you should follow the diet for at least 3 months, 2 or 3 months, strictly. After that, slowly you can eat healthy food. Don't over consume healthy food or the safe food. Sometimes people they go into flare because they over consume safe food. So don't over consume safe food also. Slowly, slowly you can start normal diet. But still many of my patients they are consuming everything. Everything means everything, which even the normal people should not be consuming. Still they tell me, sir, we are very happy, we are satisfied, we are consuming everything. I don't recommend that. In everything they say we consume dairy also, we consume alcohol also, coffee also, everything. So I won't recommend that. I would say you should follow the normal diet, which a normal person should also be consuming. So after about 2 3 months, you can uh, slowly start normal diet after no symptoms. Generally, how much time to take to cure proctitis? How much time it takes to cure proctitis? Proctitis is just a smaller version of ulcerative colitis. Uh, this is a certain area which is found in the lower colon. So it takes about, as I told you, even in colitis, even in ulcerative colitis, or even in Crohn disease, also timing is it depends on patient to patient. Many patients they respond really well within 1 or 2 months. They say we are fine. So, but usually it takes at least 6 months. Colon needs time to heal. 6 months is the time you should keep in mind. Respected Dr. Vikram, thank you very much. I am from Rajasthan Police. I was suffering from ulcerative colitis. I was worried. Uh, Now I am fine. Thank you very much. I'm also glad that you are okay. See, such feedbacks I get from daily routine to be followed from morning to night, medicine, food, yoga, etc. Yes, that is the topic. Daily routine from morning till evening. First of all, evening time. you should try to sleep. That is my message. People don't sleep. People just watch TV. People watch screens. So if you monitor your sleep time, if you check your sleep time, people put alarm to get up, to wake up. I would say put alarm to sleep. So whenever it is evening time, about 7 or 8, you start thinking about sleep, and then by 9:30 or 10, you should be sleeping. And once you are sleeping at 9:30, obviously after about 7 hours, you will be awake. At about 4:30 or 5, when you get up, go freshen up and brush your teeth using datun. I recommend datun. Datun, the Indian twig. So twig is, and also we have a tooth powder that is also very good. Tooth powder, traditional Indian herbs tooth powder we have made, and also a diamond star toothpaste made from herbs. We are recommending to our patients, purely natural. It's made from herbs. So these tooth powder and toothpaste which we have prepared for patients from all over the world can be used in the morning. Once you clean the bowel, then you drink some herbal tea, and also consume the soaked walnuts and almonds. Even if you are suffering from ulcerative colitis, you can consume about 4 or 5 soaked almonds or 4 or 5 soaked walnuts. I don't recommend cashews or pistachios. Pistachios and cashews not recommended, but almonds and walnuts, they are fine. And few raisins, 4 or 5 raisins are also good. And and then after consuming herbal tea, you can just relax for about 15-20 minutes, and then you start your yoga after taking a gap of 15-20 minutes. You can do deep breathing, you can do Bhastrika pranayam, you can do Anulom Vilom for about 15-20 minutes, half an hour, meditation for about 15-20 minutes, and then don't do Kapalbhati. Kapalbhati I don't recommend because sometimes it can cause problems in flares, especially. And meditation, what do you do in meditation? Just uh, be thankful to God Almighty. Be thankful to your parents. Be thankful to your friends. Be thankful to your family. Be thankful, and also don't think about all the relatives, all the people who did negative to you. Anybody who is negative, don't think negative. Always just try to rewire your brain system. Try to think positive during the morning hours. Then, after doing yoga and breathe, then you can take shower. In the winter time, you take shower with the warm water. In the summer time, you take with the cold water. So take shower, and then after about half an hour or 1 hour, 9:30 or so, you can take breakfast. That is khichdi with moong dal, and also you can consume. Don't consume any salads. Again, as I said, consume cumin, fennel, and thyme tea. Don't consume any salads. Yogurt is good. You can consume thick yogurt. Oats are fine. You can consume oats. And also, if you like sesame seed, once in a while, you can consume sesame seed. They are hot in nature, but sometimes they can be fine if you roast them. Roasted sesame are okay. If you soak these other uh, mm, other pulses or cereals or lentils like kidney beans, garbanzo beans, chickpeas, all these you can soak overnight and then boil in the morning and then cook in the morning. Then you can consume the soup in the morning or in at about 11 o'clock. Uh, you can take some jaggery with some rice and ghee along with some yogurt or with some lentils in the lunchtime. And chapati also you can take in the in the evening time, and also consume at about 5 o'clock. Just consume this pomegranate juice. Pomegranate juice you can consume about 100 to 150 ml 2 times a day, and also consume this green coriander leaf juice in the morning. Put some. We have spirulina capsules. We have green essential capsules. These are very important for deficiency of calcium, deficiency of iron, deficiency of other micronutrients. Spirulina is called superfood. So spirulina capsule you must consume. Open the spirulina capsule, put it in the coriander leaf juice. You can put it there, and the green essential capsule also you can put in there. You can also consume wheatgrass juice, um, and then it will be good in the evening time. Just consume this mm, pomegranate juice. Sir, I have to urinate frequently. What do I do? Urination is not a symptom of ulcerative colitis. Urination can be because of cold weather. Urination can be because of stress and anxiety and fear. So, whenever you are afraid of something or thinking too much, that can also lead to urination. So, this can be the reason. After having dinner, still I feel hungry. What to eat after 8 p.m.? After 8 p.m., you should not. I won't recommend any biscuits or any chips or something like that. You can consume some pumpkin soup if you are hungry. Pumpkin soup is suitable, or any cooked and fruits. All the fruits can be consumed except sour oranges, or but all the fruits they should be cooked, like apples or pears. Even papaya sometimes is fine, but it should be cooked. And most of the fruit, but sour fruits should not be consumed. So as I said, sugar beet or shakar kandi, beetroot, sugar beet, and apples are good. Apples you can consume, pears you can consume, all sweet fruits you can cook them and steam them, then you can consume them. Some patient complaining that hemoglobin is going down. Hemoglobin goes down because iron is going down and because of the stools having blood. So you should consume some spirulina and some green essential capsules along with some green juice. Green juice, usually I recommend wheatgrass juice and this coriander leaf or celery leaf juice. So you can in Europe there is a herb called Achillea millefolium or Reprichek. That is also very cooling. You can also drink chamomile tea in the evening, lavender tea in the evening. So these are cooling and calming. Mainly, this ulcerative colitis has a lot of impact uh, on the on the mind, on the thoughts, because many time patients they are told that it won't heal, you won't recover, your surgery has to be performed, or the polyps will grow into cancer and this will happen. See, these are assumptions and not good uh, predictions, especially to be told to a patient who is suffering. So if we tell a patient you will have this complication, you will have that complication, then the patient will be always living in fear and scared. So this is a very dangerous situation for the patient. Blueberries can we consume in ulcerative colitis? Blueberries or bilberries, all the berries, they are good in antioxidants. They are very rich, very good anti-inflammatory. But they are also sour. Sometimes they can cause, and also rich in fiber. So it is better if you consume the juice of them. And also, if you try them, take small quantity. Don't consume a lot of them. Any good food should be consumed in small quantity in ulcerative colitis. That is the rule. If you are consuming any food in big quantity, that can cause a problem. So blueberry can be tried. It is not bad. I won't say it is very good because it is rich in fiber. So fiber is not recommended in ulcerative colitis. We need to, if we need to control the flare, we need to control the diarrhea, we need to control the mucus. So always take care of the new food which you are going to add. Sir, I'm taking your medicine from 2.5 months. Relief is there, but sometimes flare comes. Is it normal during healing? Yes, it is absolutely normal. Some relief is there, but some flares are coming. Slowly, slowly, the frequency of flares will go down, and slowly the flares they will disappear. So you have to continue the medicine. Be in touch with our. Don't change anything all of a sudden. Basically, patients they get so much frustrated, they change everything. So you have to get bored from your lifestyle, but don't go into depression or sadness. Be happy, be calm. Don't go into sadness. Just be bored. Follow a bored routine. So that too much excitement is also not good. But that doesn't mean that you go into sadness. So live a very peaceful and contented life. Be happy and follow a good routine. Soya bean is very good. You can take soya bean. So it is not bad. Good, full of protein. So, but it has to be cooked really well, so you can consume it. Soybean is fine. Even besan is fine. Besan is chickpea flour, the flour made from the chickpeas, from the white chana, or the black chana also is fine. But don't overdo it. Try it for some time because it is heating also, but you can take it because we have to take care of the nutrition also. Ulcerative colitis patient they don't gain weight even after this is the question, even after stopping the medicines, even if medicines are over. Yes, many patients they come to me because they leave the doctors, they leave the medicine, they forget the disease, and they leave the doctors also. They leave us also. It is a good thing that you leave us. We are happy, but to gain weight, we need to guide you about your food, about your sleeping habits, about your stressful lifestyle. Then slowly you will start. I have many patients who come to me. They say we have gained weight. Even yesterday there was a patient she was saying she gained weight. So a lot of patients they gain weight, and we have some herbs also. We have a shatavari capsule we for women to gain weight. We have muesli strength for helping in gaining weight. We have female health support. I also give brahmi and sometimes neurogen. Neurogen is having ashwagandha also. So ashwagandha in small dosages can be given to colitis patient depending upon their status. So neurogen, ashwagandha, brahmi, tribulus power is there. It helps to. Soya bean is good or bad? Soya bean is good. It's not bad. You can take it. Soya bean, but must be cooked and boiled. First boiled, then cooked properly. How long should I continue Ayurvedic medicines to maintain the remission? Well, you don't have to consume them for long. Usually, I stop them once the remission is achieved within 2 3 months. I stop all Ayurvedic medicines, and then you can live without Ayurvedic medicines also. I have patients who are doing very fine even after 15 years of leaving all medicines. They are not taking any allopathic, any Ayurvedic. They're still fine, and they have put their videos on my channel, so you can see them. There is some colonel also. He says he's consuming everything, and another person from USA he's also consuming. Many people from India also. My colitis keeps on recurring. It has been 1.5 years since I started the medicine. So recurrent ulcerative colitis means the fear is there, some some stress is there, some anxiety is there, or some irregularity is there, some sleeplessness is there. So you must consult with our doctor. Note down. Don't live irregular lifestyle. Lead a very peaceful and regular lifestyle. Start forgiving people. Don't argue with people. Leave them whatever they want to do. Meditate regularly, and don't watch TV or mobile phone or these reels in the night time, or even during the daytime. It's just a wastage of time. uh, Always be peaceful and eat healthy food. By healthy means safe food, as per colitis, as per our diet. Don't skip meal. Don't overeat, and don't eat too much of curd. Also, sometimes too much of safe food is also bad. So you have to discuss with our doctors. You can, and sometimes don't eat salads. People consume salads. A lot of cold smoothies also they consume. Importance of probiotic and prebiotic in colitis. Recommend some primary food: beetroot, kanji, sauerkraut. All these foods I don't recommend. Usually, many doctors they recommend these: beetroot, kanji. This can this is a double-edged sword. It can work, it cannot work. Prebiotic and probiotic. I'm giving yogurt. I'm giving curd. So curd is fine. Curd is. I'm giving everything according to Ayurvedic principles. Curd is abhishandi according to Ayurveda. It blocks the channels. It is not good for health according to Ayurveda. It's very heavy and difficult to digest. But it stops diarrhea. It helps in symptom. It is a symptomatic relief. So curd and also good prebiotic, also good probiotic, and also good in giving strength and calcium and also protein. So that's why I keep the curd in my ulcerative colitis diet. So you should take curd rather than kanji. Kanji I don't recommend. I and sauerkraut also no sour things. I don't recommend sour things. And the primary food is khichdi in Ayurveda for Raktatisar or Pittatisar, this ulcerative colitis. The primary food is khichdi, rice gruel made with moong dal. That is what I would recommend. Many patients they consume keto diet. A lot of I have few patients from UAE. They consume a lot of heavy meats. So meats I don't recommend. Sometimes soups are okay. But usually I don't recommend these keto diets. They can be. They want to take fiber-free food, but still this can lead to more inflammation and a lot of natural vegan protein sources. I'm coming up with a vegan protein powder. Nowadays, everybody wants protein powder, and something to gain weight. So I'm coming up with a vegan protein powder. I have made it for myself, for my personal use, and anything which I make for my personal use, like I made Arjun D for my personal use. I made this GR gas relief kada for my personal use means for myself, for my friends, for my family. So all these herbs I have made from my friends and my patients. So my patients are also like my family. So this vegan protein powder will be out within 1 month. I'm trying to cut down the cost, but it is difficult because I am preparing it for my family. And whenever I make something for my family, I don't compromise. That is another problem, but I will try to cut down the cost, but keep the quality optimum. So it will be vegan protein without any milk or milk products or whey. Whey is very cheap, but I won't be using whey in that protein powder. Sir, what medicine you suggest for pseudo polyps? Sometimes the polyps they formed in the colon. So whenever you go for colonoscopy, sometimes the doctor they say there is a polyp, we will remove it. It's okay. There is no harm in removing them. So you can get them removed. So if the doctor asked for them, so it is okay. And also don't be scared of polyps. If you have polyps, that you will get cancer, because sometimes doctors they say you will get cancer. Polyps. When you have polyps, there are chances of getting cancer. It is true, it is not true. So don't be scared, don't worry about it. Sometimes, uh, you see, after many years of some disease, many years, in 20 years, 25 years, 30 years, some people they get cancer, not only from ulcerative colitis, but also people are having cancer without any reason. So you don't be scared of your pseudo polyps or polyps. There are herbs like this wood apple or this eagle plan. We have capsules eagle plan and this belgiri. And this belgiri, and there is also licorice, madhu yasti or yasti madhu ghanvati. We have tablets. So they help to ease the inflammation and calm down the flares. Can I use bhang? Bhang is weed. Weed is getting popular in USA, Canada, and many other European countries. Also, but I don't recommend this at all. A lot of people are doing a lot of research on it. Ayurveda says it is habit forming, so that's why I don't recommend weed at all in any condition. And then there is how we can manage stress in demanding police duties. Yes, it is very difficult in police and army, even in corporate world, in IT sector also. Everybody is living in stress nowadays. So this is we have to change our attitude. Stress are the circumstances, and our reaction to those circumstances is called stress. So same person can or two different person can have different reactions in the same situation. So if it is not that you are having stress, some police people who are senior or junior to you, you can see them, they are not having stress, but they are living normal lives, and you are having more stress than them. So it is your attitude. You have to change the attitude. Start changing yourself rather than changing anything else. Stop controlling anything else, all the situations. Sometimes the situation cannot be in your control. So you have to meditate, talk to yourself, talk to God Almighty every morning, as I said. Then you will see that there is no need to control anything. Things are happening on their own, and sometimes we have to let it go. How can we manage stress? Okay, I have answered that question. So we will do these sessions again and again. I'm not leaving you. I don't want to leave you. I know you are watching me and you are dependent on me and you want me, and that's why you are here to listen to my talk. So I will be live again this Saturday. Um, it will be in Hindi language, so you can join again. So this time, I hope it was useful. And next time, it will be again ulcerative colitis on this Saturday. And after that, I will be routinely doing live sessions talking about different conditions, about liver, about ITP, about skin problems, and general Ayurveda problems. So just uh, keep following and just subscribe to this channel. Just write comments. You can also ask questions after this video to different any of my videos. You can put comments and your questions, and we will answer them. Sometimes I answer them personally, And as I told you, always talk to our doctors. Sometimes people they say we cannot get your medicine, just we cannot afford your medicine. That is why I'm saying talk to our doctors. The doctors will definitely give you some alternative or suggest you some home remedies. Uh, and you can also, we have distributors in different locations all over India, all over world. I have created Planet Ayurveda. I have named it as Planet Ayurveda 25 years ago. So why I named it Planet Ayurveda? I wanted Ayurveda to be all over the planet. Ayurveda is not only medicines. Ayurveda is how you live, how you think. So you have to learn how to live. You have to learn how to think. You have to learn how to eat and when to sleep. So these are the principles I want to teach to live a healthy life, not only be dependent on medicines. Medicines are available. You just go to the website, you can order them, just plan it properly. Plan your shipment in time, your order in time. And if you don't have the medicine, talk to our doctors and check our website. Maybe the distributor, our medicine shop is just right to next to your home. So somebody is saying thank you very much. You are our motivation, and I would say you are also my motivation. If you are there, I'm also motivated. If I see somebody getting healed who comes to me and says, "Sir, I am fine now. I am free from disease," so that is my reward. That is why I did my MD, and that is the reward I am getting, and that is the highest satisfaction I get. Okay, somebody saying, sir, you are looking very smart. Thank you very much. I learned to wear these clothes from Europe. So I went to Europe. They say you should wear such clothes, not Indian clothes. It's okay. These clothes are fine. Any clothes are fine. We should not say that these clothes are good, that clothes are good. Everything is fine as long as your intentions are fine. My stools are becoming tight. Should any medicine be reduced? Yes, you should reduce if the stools are getting tighter. You stop or reduce Kutaj Ganvati, that is, or Prabal Panchamrit or Vatsakadi Churna. So you should talk to our doctors. That's what I am saying. If the stools are becoming tight, really good thinking to stop medication, but suddenly got flare up. It will how much time to get cured? Okay, so you were thinking to stop the medicines. You can stop the medicines under guidance of our doctors. If the flare is there, it will go away within 1 week or 10 days. Just follow up the same medicines. Doctor is suggesting for injection. Shall I take? Somebody is asking the doctor injection. Injections, I am not very much in favor of injections. They are, if your doctor is suggesting, but before the injection, you can try our Ayurvedic medicines. Injections, recently injections are discovered in the last 10, 15 years. This Humira or rituximab or such Entyvio, such injections are there, infliximab. So all these injections, they sometimes they work, also sometimes they don't work. But once they work, then you cannot get rid of them. It is very difficult, takes a lot of time, and they are also very expensive. In India, they are not covered by insurance. In Europe and USA, they are covered. And it is not about they are being covered or not by insurance. It's about whether there is a need to start or not. Somebody is asking, your products are the best. Keep your good work. Thank you, Siddhant Kalraji. Thank you very much. That I will come more often. Yes, I will come. Definitely, I will. That's why I have started. And some pus in the gums. As I told you, we have this gum care powder and also diamond star toothpaste. You can use them. Otherwise, for the gums, you can put some mustard oil also if you don't want to take anything, and some take some this alum called fitkery. This alum you can take and put some mustard oil and rub it, put some neem oil, rub it on your gums, and definitely, or also do this gargles or pulling, oil pulling. Just take some oil, this neem oil, and pull it like that, and this will also help. And also do the massage, or take the gum care powder or diamond star tooth paste. Harsh music, sir. Medicine has caused sometimes patients they develop piles because of too much of pressure. Whenever you put too much pressure on the on their colon, that can lead to piles and fistula. Always make sure that you don't have to exert pressure on it. Apply some nirgundi oil or any, or coconut oil if you don't have any. You can take our pile of capsule, also very useful. Also take this mimosa D for piles, but apply some nirgundi and jatyadi oil together to to calm down the pile flare. I'm on fair. Can I take Mesacols to stop? Yeah, Mesocol works me well. Yes, you can take. So don't hesitate to take allopathic medicine, and don't hesitate to take any consultation with allopathic doctor also. I'm not against them. I'm not against allopathic doctors. They are also doing their best. But you don't be scared. If any doctor tells you that we have to take out your intestine, just take Ayurvedic consultation. That's what I am saying. Ayurveda can also play a role in that. So if you feel that we are very far and we are not reachable, in fact, we are not far. You can just go to the website, you can check, just book an appointment, talk to our doctors. But still, if you want to use Mesacol, I have no problem. You can use it. It's not that bad. For some times, it's useful. So it's okay. But don't be scared. Slowly, slowly, we will stop that also. And somebody saying, I don't get relief from piles. So again, I'm telling you, you have to follow up with our doctors. And ITP questions I will take in the next session. Again, the same question, can it be cured? Will it be fine? Will I? This is telling me your anxiety. This is telling me that you are fearful. I have told you in Ayurveda it is called Raktatisar or Pittatisar. This ulcerative colitis has another name, and according to Ayurveda, this Pittatisar is difficult to cure, but it is curable. So Pittatisar can be cured completely. So your disease will be cured completely, and you will be fine. And if you don't believe me, just go to YouTube and check my channel and see the patient. If you don't believe the channel, just come to my clinic and you can see and meet real people and talk to them. Just follow the diet, that's true. So, hepatomegaly, we'll talk about the liver in the next session. I think I have covered most of the questions. So some products which I would say Hemostop astringent is very good for the bloody diarrhea. Hemostop B is very good for the bloody diarrhea. So these I made using certain herbs which are good for diarrhea. And don't mix Ayurveda with other mm, Ayurveda diet with other keto diet or other diet. So don't mix the diet. Follow one doctor, follow one diet. Don't do experiments. Don't eat salads or cold smoothies or cold water or dry snacks, and don't hold gas. And gas, sometimes gas and bloating can be very difficult for colitis patient. We have GR gas leaf kada, as I told you. This GR gas leaf decoction you can consume 2 to 3 times a day. This is helping in gas and bloating and also indigestion. So I think this is it. So thank you very much for 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 being with me. This session I took 10 more minutes, 10 minutes extra, because I think you had so many questions, and I will take 1 or 2 more questions. I will see if IT. What do I do for ITP? What do I do for ITP? ITP I will take next time. ITP also is possible to get rid of this problem. So if the stools are becoming firm, yes, you can reduce the medicine. You can stop Kutaj Ganvati. You can stop Kutaj Ganvati. You can stop diarrhea, Udi powder. You can stop Arjuna powder. All of these. You can take only Pitta balance. That's it. That's it. So I was talking to Dhannar PTC, Dhanna PTC. So I think this time it is enough. We will talk next time. I will be here more often. Thank you very much. Thank you.